President Trump is projecting a lot of confidence about the fate of the Republican health care bill, despite the fact it's been met with criticism from nearly every interest group, all the Democrats in Congress, and a large group of both conservative and moderate Republicans. The president met today with a group of skeptical members of Congress from the Conservative Republican Study Committee. He says he was able to convince everyone to vote for Trumpcare, and he didn't stop talking about it all day.
All of these no's, or potential no's, are all yeses. Every single person sitting in this room is now a yes. We met with 12 pretty much no's, 12 no's or semi-no's, no yeses. 100% of the no's are yeses, and some of them were strong no's. Some were just no's, and we had a couple that were mixed. They went from all no's to all yeses. And we have a lot of yeses coming in. It's all coming together. These folks were no's, mostly no's.
Yes, that's correct.
Yesterday. And now every single one is a yes.
There are just a few problems with that. For one, Justin Amash, a member of the Republican Study Committee, tweeted this morning it is, quote, absolutely not true that conservatives have flipped to yes on the health care bill. Congressman Mark Meadows of the House Freedom Caucus, who bedeviled John Boehner when he had the job as Speaker, said this afternoon there are 40 no votes, according to his whip count, enough to defeat the bill. And perhaps most importantly, the bill is bleeding votes in the Senate day by day. Rand Paul is a no. Just yesterday, Susan Collins of Maine came out as a no. And Dean Heller of Nevada crucially said today he, too, cannot support the bill in its current state. So the specter that appears to be looming now over the House is that Republicans are going to be forced to go on the record and vote to kick people off health insurance, only to possibly have to watch the bill die in the Senate. Joining me now, one of the Republicans who will be asked to take a vote on the health care bill, Republican Congressman Jim Banks, Indiana's 3rd District. He's a member of the Republican Study Committee who was in the meeting with the president this morning. My understanding is you are a tentative yes if there are changes, and I'm reading your statement here. What are the changes you're looking to see in the bill to get you to yes?
Well, that's right, Chris. This morning we had an opportunity to dialogue with the president and talk about a number of conservative changes that we can make to the American Health Care Act to make it more palatable to conservatives like me to move it forward. One of those most significant provisions is a true block grant program to the states to give more flexibility to states like Indiana to administer these programs on their own without the red tape and bureaucracy of the federal government. If we can do that, cap the expansion of Medicaid, protect the pro-life provisions in the American Health Care Act, then we'll go a long way toward making this more possible for conservatives like me to support the bill.
So do you have yeses on those?
On the floor projected for on Thursday.
Do you have yeses on those?
I was a maybe. I want to meet the commitment and promise that I made to the voters in my district that I would vote to repeal and replace Obamacare. I did not feel like the American Health Care Act fully met that commitment, and believe that it's still this legislation is still far from the framework of what I had hoped to be able to vote on as a conservative in this Congress. But if we make the promise, if we make the changes that the president promised that he would support this morning in the Oval Office, then as a conservative, I can get a lot further toward a yes vote than what I was before.
Can I ask you this? Do you think the Affordable Care Act was passed too quickly?
I wasn't a member of Congress then.
Sure, you were a citizen,
just 10 weeks into the job on Capitol Hill. I didn't have the opportunity to participate in that debate or even follow it closely, as I was a state senator at the time. What I do appreciate about the American Health Care Act is that the Speaker and the House leadership have gone at lengths to make this a very transparent process.
But Congressman, let me ask you this. You guys are going to vote on this on Thursday. You're going to vote on this on Thursday. That's 17 days from the day the text of the bill was introduced. There's been not one public hearing with witnesses called. 1/5 of the economy is health care. You're looking at a 64-year-old in your district who makes $26,000 a year, who's going to see his premiums go to $14,000 a year. Why the rush? Why 17 days to reorder 1/5 of the American economy?
Chris, I do believe that the process over the past 10 weeks since I was sworn in as a new member of Congress has been transparent. We've had a very healthy and constructive debate over the best way to repeal and replace Obamacare.
Right, I'm asking about the pace and not the transparency. I get the transparency, but it's going to be 17 days if you guys vote on Thursday. 17 days between the text of the bill with all the details, the complications. In fact, the president himself said healthcare is complicated, and I think you and I would agree it's quite complicated. 17 days from introducing a piece of legislation to reorder 1/5 the American economy to a vote. Why rush so quickly?
Oh, Chris, I don't think we can rush quickly enough to meet the promise that we made to repeal and replace Obamacare. As we watch Obamacare literally collapse in on itself with a number of providers leaving the healthcare exchange, we've got to do something. We've got to do it quickly. That's why I believe that we have to move forward on this piece of legislation and find a way to make it better.
I want to ask you what you made of this line in the CBO report, because I've heard this from you and your colleagues that it's collapsing. It said the non-group market would probably be stable in most areas under either current law legislation. The American Association of Actuaries says there is no death spiral. It seems strange to me that you and your colleagues reiterate that Obamacare is imploding or in a death spiral when the experts tasked with evaluating that say that is not true.
On Election Day on November 8th, Chris, the voters chose Republicans to lead based on a commitment and promise that we would repeal and replace Obamacare. The voters
may be
spoke
true,
loud
Congressman,
and
but
clear.
that's not responsive to the
Congress
right. But
today.
It's a question. I get that, and obviously that's the case. And you and your colleagues control the House and the Senate, and also the White House. But it's a specific question about the actual state of the insurance market, which isn't something that voters determine one way or the other. That's a fact about how those markets are functioning. And the American Association of Actuaries and the Congressional Budget Office agree it's not in a death spiral and it's not imploding. And so I'm just wondering why you and your colleagues say that it is.
Chris, what is clear is that the replacement proposal that we are debating in the Congress today, with some significant changes that we can make that we discussed in the Oval Office this morning, could result in a health care program in this country that will work for far more Americans than what we have under Obamacare, with rising premiums, fewer choices for the American people. Over a third of the counties in America only have one choice to choose from in the exchange, and I believe that if we repeal Obamacare and replace it with a patient-driven program based on free market and conservative principles like we are moving in the direction of, especially with the changes that we discussed with the president this morning.
Can I ask you
we will come up with a program that works better for more Americans than what we have under Obamacare.
A logistical question about that. Those changes, they're going to be made, and then the bill text is going to be published. We're going to see that, and then you're going to vote on Thursday. Is that the sequence?
When we get back to Washington next week, it is my understanding that a manager's amendment will be proposed in the Rules Committee, which will address the commitment that the president and his team, as well as House leadership, have agreed to make these conservative changes to move this forward to gain more support from conservatives in the House. That's what it will take to get my vote. To move this forward would be to see those changes made. I'm hopeful that will occur at the outset of next week.
One of those changes is a Medicaid work requirement. I want to ask you, Congressman, if you will come back next week to talk about the Medicaid work requirement, because I think it's an important piece of policy. I'd love to talk to you about it next week.
Chris, I believe that's one of the most significant changes. I'd be happy to come back and talk to you about that next week as well.
It is a date, Congressman. Congressman Jim Banks of Indiana, thanks for joining me. Appreciate it.